into the new year. And hopefully you haven't abandoned your New Year's resolutions just yet. Today in Mental Health and Me, we're talking about dry January. I'm sure you've heard of it. Dr. Sheryl Ziegler joining us now, psychologist and our 90s parenting expert. Always so great to see you and talk to you. So some people choose to be sober this month. It's kind of something that's really taken on a whole new meaning in the last couple of years. Why has dry January taken off, do you think?
So I think dry January has become really popular for a couple of reasons. A lot of times coming off of the holiday season, people have eaten more, they've drank more alcohol. And I think this year people are interested in it because it's not just been a season, it's really been almost 2 years where we've seen increased alcohol intake during this pandemic as a way to manage stress. And so people are really wanting to do it to either detox or because they actually think that maybe they have been drinking too much.
Yeah, I completely understand that. Can you talk from just, a medical standpoint, how alcohol truly affects our mental health?
Yeah, so when we drink alcohol, we have disturbed sleep, we can have memory problems. It can actually increase symptoms of depression and anxiety. So people don't realize, because a lot of times they use alcohol to feel calmer or more relaxed, that actually there's detrimental mental health benefits when used either very regularly or in excess.
And I love that you pointed out this is something that, some of us have been dealing with for essentially 2 years. Even without a problem, we've been leaning on alcohol just a little bit more to get through what's been, a really tough time for a lot of us. It's not an easy process to give up alcohol, even for a short term. Like, how can we set ourselves up for success if this is something we want to do?
Yeah, I think that's a really good point. It is hard to do this for some people. So if you want to do this dry January thing and, we're 10 days into January, it doesn't matter whenever you start. Basically, if you want to give yourself a 30-day kind of break from alcohol, first know that just in 30 days, there will be noticeable, measurable differences, improvements in your mental and physical health. And so there's data to show that. But there's a couple of things you can do. You can replace that drink. So if you know that you're going out socially, or you know that you typically have a glass of wine at dinner or something like that, you've got to think about a replacement drink. That's really important. The other thing is tell your family, let people, if you live with other people, let them know this is what I'm doing, because they're much more likely to hold you accountable, support you, and probably do it along with you. The other thing is get rid of the alcohol in your house. You don't want that around as a temptation, because that will be really hard. And if you do give into a temptation, if you do drink one night, you feel upset with yourself, don't stress that out. Don't stress out about that. Just the next day, just start over. That's where people go wrong on these New Year's resolutions or goals. They mess up one time and they go, oh, forget it. And there's no need to do that. You can just start again the next day.
Yeah, certainly believe in yourself that you can do this. And it takes planning. It's not just like cold turkey, I'm going to do this. Use your support system. Such good advice per usual. So Dr. Ziegler, thank you for being here.